Seeking treatment for obesity is a very sensitive and difficult thing to do, and making that initial step to look for a physician to help you is the most difficult step. When you come in, we help you to start the journey from the very beginning. You have your initial consultation with me, where we sit down, we talk about your goals, talk about your aspirations and your expectations. Then if you do decide that you want to go forward with surgery, then we look at all the necessary requirements by your insurance. Very often this encompasses meetings or visits with a dietitian, which is going to be on a regular basis, where you sit down and talk with her about what your meals are like, what you eat, and she'll help you to try to get you prepared for after surgery. Then you'll have a psychological assessment. This is very often required by an insurance company because they want to be sure that you understand that this is not a sprint. This is a long journey, because we want you to keep the weight off on the long term. So we want to understand that this is a lifestyle change, hence the psychological assessment. After that, we do a cardiac assessment to ensure that your heart can tolerate surgery, because surgery is a big stressor. We want to make sure that your heart can tolerate the surgery, and if it is, and everything is okay, we go ahead and get you set up for surgery. One other thing that we do is do an upper endoscopy. The endoscopy is to look at the anatomy on the inside of the stomach and the first part of the small bowel. We also check to make sure that you don't have any other surgical problems that can be fixed, for instance, a hiatal hernia. And we take a biopsy from the inside to make sure you do not have any bacteria that can cause ulcers, because ulcers, unfortunately, is one of the complications we do not want you to have after weight loss surgery. Also, we do an abdominal ultrasound. One of the major diseases associated with obesity is fatty changes of the liver. We do an ultrasound of your abdomen to look at your liver, and if we do find these changes, I always recommend doing a biopsy of your liver at the same time. What that does is to assess the severity of the disease, because if it is severe, we can go ahead and refer you to a liver specialist, because that has to be monitored closely. Very often, if it's mild and you lose the weight, the liver regenerates and fixes the problem. When all this is done, we go ahead and submit to your insurance, and then they give us the pre-authorization to go ahead and do your surgery.